November 2025 could be the most critical month for Social Security recipients in decades. And what's coming will shock you. While most people are celebrating this year's 3.2% cost of living adjustment that added about $65 to the average monthly check, 4 devastating changes are approaching that could completely derail your retirement plans. After analyzing retirement trends for over 2 decades, I've never witnessed a perfect storm quite like this one brewing. Drop a comment with your current retirement savings amount because what I'm about to reveal could determine whether you retire comfortably or struggle financially for the rest of your life. The most dangerous trap that financial advisors won't tell you about is how your 2026 Social Security increase is already being devoured before you even see it. Medicare Part B premiums are projected to skyrocket to $198 monthly in 2026, representing a massive $13 increase from current levels. That's a staggering 7.0% jump while your Social Security is only rising by 3.2%. Let's break down this devastating math. If you're receiving that average $65 monthly Social Security increase, Medicare immediately claws back $13 of it, leaving you with just $52 of real purchasing power. For countless retirees, that barely covers the cost of one prescription medication, let alone keeping up with inflation on everyday essentials. The timing makes this even more brutal. Your COLA kicks in during January, but Medicare premium increases hit 3 months earlier in October, creating a financially destructive gap where your actual spending power shrinks for an entire quarter before any relief arrives. Most retirees are completely unaware they're financially bleeding for 3 months every single year. November 15th represents the final deadline for a change that 350,000 Social Security recipients are completely unprepared for. The federal government is permanently eliminating paper checks through a mandate that extends previous executive orders, and if you haven't transitioned to electronic payments, you're facing a potential financial disaster. The official reasoning centers on fraud prevention and administrative costs, and the statistics support this. Paper check theft has exploded by 300% in certain metropolitan areas, with criminals specifically targeting Social Security payments. But here's the alarming reality nobody's discussing. The demographics still relying on paper checks represent our most financially vulnerable population. We're talking about individuals without traditional banking relationships, seniors who fear digital technology, and people living in areas where reliable internet access remains limited. The Treasury has established an emergency waiver system through 888-382-3311, but awareness of this lifeline is practically non-existent. The third issue operating completely beneath public awareness is the hold harmless provision, and this regulation is both protecting you and potentially penalizing you simultaneously. When Medicare Part B premiums surge beyond your COLA increase, this rule theoretically prevents your net Social Security payment from decreasing. This sounds like consumer protection until you understand the devastating loophole. This safeguard only applies if Medicare premiums are automatically deducted from your Social Security payments. If you handle Medicare payments independently, you receive zero protection and absorb the full financial impact. Even more concerning, this provision creates significant inequalities within the same communities where some retirees see benefit increases while their neighbors remain frozen at identical payment levels, despite facing identical cost pressures. The November 15th announcement everyone's anticipating will reveal the 2027 COLA projections, and preliminary calculations suggest approximately 3.1%. This translates to roughly $58 additional monthly for average recipients, potentially increasing benefits from approximately $2,710 to around $2,768. These numbers appear reasonable until you examine the fundamental methodology driving these calculations. The Consumer Price Index for urban wage earners and clerical workers might sound comprehensive, but it's measuring completely wrong demographics. This index tracks working-age individuals rather than retirees, creating systematic miscalculations. The consequences are financially devastating. The index dramatically underweights housing and medical expenses while overweighting transportation and technology costs. Consider your personal budget allocation. How much do you spend monthly on gasoline compared to prescription medications and medical procedures? The formula has been systematically shortchanging seniors for over 15 years. The Senior Citizens League has calculated that using the Consumer Price Index for the elderly would provide approximately $425 more monthly for current retirees. That represents real money systematically stripped from your retirement security year after year. Financial experts are issuing urgent warnings that Medicare Part B premiums could increase dramatically in 2027, potentially eliminating most or all of that projected $58 COLA increase. We're witnessing a destructive pattern where cost of living adjustments get announced with great media attention, then silently disappear into escalating Medicare costs. The sixth critical problem involves what experts call the inflation timing trap. Your COLA gets calculated using July, August, and September economic data from this year compared to the previous year. But economic reality doesn't stop in September. What happens when inflation continues climbing through October, November, and December? You're permanently locked into an outdated adjustment that completely ignores current economic conditions, leaving you financially exposed for months. Here's the seventh issue affecting millions but receiving zero media coverage. The method Social Security uses to calculate your highest 35 years of earnings for benefit determination doesn't properly account for inflation's impact. Your earnings from the 1980s and 1990s get indexed to wage growth rather than actual purchasing power. This seemingly technical detail means countless people's benefits are calculated using artificially deflated historical earnings, permanently reducing their monthly payments. The eighth trap involves Social Security benefit taxation, and this mechanism is particularly insidious. The income thresholds determining whether your benefits face taxation were established in 1983 and have never received inflation adjustments. 4 decades ago, only genuinely wealthy retirees paid taxes on Social Security benefits. Today, middle-class retirees routinely see up to 85% of their benefits subject to federal taxation because those thresholds have remained completely frozen while everything else has inflated dramatically. Here's the most catastrophic issue, and this is why understanding these problems is absolutely critical. The entire Social Security system operates on assumptions about retirement that bear no resemblance to current reality. The original formula assumed you'd have multiple significant income sources, shorter lifespans, and minimal medical expenses. None of these assumptions remain accurate. The result is a system providing diminishing real purchasing power annually, even with cost of living adjustments. The solution isn't waiting for Washington to address these systemic failures. It's understanding these 8 traps and developing strategies to navigate around them. If you're approaching retirement, maximize your highest earning years immediately before they become locked into that 35-year calculation. If you're already retired, consider Roth conversion strategies during low-income years to minimize future tax burdens on your benefits. Most critically, never depend on Social Security as your sole retirement income source. That November 15th announcement won't solve the fundamental mathematical problems facing today's retirees. Subscribe if this analysis reveals the truth about what's really happening with Social Security, because these changes will impact every single person planning retirement in America. There's one more critical aspect of that November 15th date that could be the most important revelation of all. The Social Security Administration isn't just announcing the 2027 COLA that day. They're also releasing updated trustee projections, and the numbers are genuinely frightening. Current projections indicate the trust fund could face automatic 23% across-the-board benefit cuts by 2033 if no legislative action occurs. That's less than 8 years away. Here's what this means in actual dollars. If you're currently receiving that average $2,710 monthly benefit, a 23% reduction would drop your payment to approximately $2,087. If you're planning retirement within the next decade, your expected benefits could be slashed before you begin collecting. The political reality is that major Social Security reforms typically only happen during absolute crisis moments, and we're rapidly approaching that threshold. Wealthy individuals have multiple options. They can delay Social Security claiming, maximize other retirement vehicles, and survive benefit reductions. But if you're depending on Social Security for 50% or more of your retirement income, like most Americans, these aren't abstract statistics. They represent the difference between maintaining dignity in retirement or facing impossible choices between essential medications and basic nutrition. This is precisely why understanding these 8 traps isn't merely helpful information, it's essential for your financial survival in the challenging years ahead.